Good afternoon, everyone. Thank you for taking the time out and the effort to join this meeting and dialogue this afternoon. We are so pleased to have you, we being the UN system in Belize. But most importantly, what we want to recognize also is the presence of you who represent the indigenous populations in Belize. This past week, we celebrated the International Day of the World's Indigenous People. They are a crucial part of our population, both nationally and internationally. In fact, a quick check of our population here in Belize indicate that Indigenous people make up at least 17% of our population. That's a sizable sum, and that's a population that we cannot ignore and that require also some level of consultation and a seat at the table for development. In front of us, we have this enormous shock of COVID-19, and it is taking a toll on populations across Belize, but without any doubt, I'm sure that it's also having significant impact on you as Indigenous people. Where you live, what you do, your traditions and your practices are being affected by this pandemic. We could not have planned for the impact that we're feeling today as a result of COVID-19. Hence, it's important for us to have this conversation and to talk with you as the UN embarks on a strategic way of supporting the government in the context of this pandemic, and also ensuring that the indigenous population, among many others, are not left behind because of the shock, the stress, the uncertainty that this pandemic will cause in Belize and in our region as a whole. First of all, I want to also add Happy International Day of the World's Indigenous People. I hope you celebrated it accordingly and based on your traditions and practices. I do want to recognize in this meeting today the Mayan and Garifuna populations who are considered Belize's indigenous people. We have an hour with the UN heads of offices and here in Belize. So without any further ado, I will pass on the mic to Ms. Birgit Gerstenberg. She is the resident coordinator for Belize and El Salvador, I must add. But for today and for this hour, we have her talking with you and hearing from you in the context of the COVID-19 pandemic, and offering you her ear and also the opportunity to engage with other UN offices that are here and that she will also share with you and introduce to you. Thank you. Very good.
Yes, I would like to share my screen. Is that possible? Can you just...
Yes, you have sharing rights.
Yeah. No, but because there is already something shared, so you have to take the agenda down. Yeah, thank you. I would like you to play in first the message of the Secretary General to the World Indigenous International Day, because I think he says a lot of what I could not say so beautiful how he did. So let me just share this 1-minute video before I address the word to you.
Do you have it on volume? Are you hearing it on your computer, Birgit?
I can't do anything.
if we could watch the subtitle, that will have to work because the videos don't play on Zoom audio. So if we could look at the words for now, we won't hear sound on Zoom.
Look, I will stop sharing if you didn't hear, but I will put you the link in the chat. So, because I could not do anything about the volume. The volume, I hear it. If you didn't hear, I am very sorry, but I will put it in, there's the chat box. Let me just see. I will put the, I will put the link in the chat so you can hear it by yourself, no? Because I wanted you to have that introduction to the World Indigenous Day from the Secretary General, because I think he touched some very important points on how United Nations are looking at Indigenous people as a group of people that suffers in a very specific way the effects of the pandemic, and is also suffering a extension and deepening of what already is happening at many levels of in terms of discrimination, marginalization, as well as suffering more poverty and other deprivations or exclusions from other parts of the society. He talked about children without access to internet and virtual learning, as well as the high impact that the informal sector, or the shutdown of the informal sector has on Indigenous people where they mostly work. So I don't want to go more into the detail of the message. I sent you the link so you can watch it by yourself. The United Nations in Belize have long-standing relations with Indigenous people in Belize, and I am very happy to greet colleagues of the UN country team in this meeting, and it was for us an internal really pleasure and need to talk to you during the week of the International Day for Indigenous people, because we thought that's an opportunity to redo the contact from my side, because I am in my function since last year, but last year October. But due to the emergency, to the pandemic, I was not able to come into Belize since February, and I would have loved to meet with civil society and among civil society organizations, obviously with BENIC, with the Belizean organization of Indigenous people, to have an exchange about how what is your program, what are your needs, what are your expectations towards the United Nations. So we are all aware that there are international normative frameworks in place for Indigenous people, like the ILO Convention 169 and the Declaration of Indigenous Peoples' Rights. There are also in place national frameworks which are benefiting Indigenous peoples, and we have traditionally worked by many agencies, for example, PAHO and UNICEF, with Indigenous peoples organizations and communities to strengthen their community resilience in terms of several development matters. Today, we have convened this meeting, not only that we thought, as I said, it's a good opportunity, but also with a very pragmatic reason to have you telling us how the pandemic is affecting your communities, your life, in terms of also communicating with us on your needs, on your expectations towards what are priorities that should be tackled, that should be taken into account, not only in our programs, but also in government programs. You know, we have ongoing dialogue also with the government on needs and urgencies that we have to treat within the pandemic and the crisis which it is practically causing, you know, in many senses. So we thought that this dialogue today is in particular to look at your situation, not wanting to have you invisible in the concert of different population sectors. We also want that your rights are taken into account, that your needs are reflected, and also to have your voice in our proposal on how to tackle the emergency, the crisis. Belize is in a very special situation, I would say, because the cases are still low, but we can't know what will happen. And the last development over the last days also shows that there's a possible increase of cases which, apart from the economic crisis, will have an effect on the health situation of the population. So we would like to listen to you about your access to the health system. How do you feel with this pandemic in your communities? What measures have you been able to take, and how we can support you specifically? Also, the education sector would be very interesting to have some ideas how your children are tackling the situation, not going to school. What are the principal challenges, also to take note of it. Same about the situation of work, of employment, of being able to get the necessary income to survive this part, as well as food security. And obviously, we always are asking to have more details about the situation of children and women and elderly who are especially vulnerable groups among every community. You know? So we would be really grateful if you can talk about this. Also, looking at our work as United Nations, and I have my colleagues here with me who will then contribute also from their perspective what they are doing and how they are engaging with organizations and communities from the indigenous part of the population. So that would be my words. I'm very sorry that you couldn't hear the Secretary General words, but I hope you can just look at it. It's 1.5 minutes, not that long. Thank you so much, and I would hand over back the use of the word to Jay.
Thank you. Birgit explained the context in which we are engaging with you, and so we would like to also hear from you in this very specific time frame, what it is that you want to share with the UN offices here and their representatives. And so we do so, asking each of you then to share at least 4 or 5 minutes worth of issues, considerations, concerns, but also some insights on how it is that you can partner and be supported by the United Nations in Belize. So there are, of course, 7 entities or 7 individuals coming from the 3 organizations present here, BENIC. And we'd like to start with Ms. Miranda, who is the president of BENIC, BENIC being the Belize National Indigenous Council. Ms. Miranda? And if you feel brave enough to put on your cover, that's fine. You don't have to.
Well, good evening, everybody. And welcome. I am glad to have this session. So I'm very grateful for UNDP to actually invite us. It's never too late. Just the fact that you recognize that we are an Indigenous group makes it very important for us that you are prepared to hear our voices, right? So we are very grateful for that. And on behalf of BENIC, I'll say thank you. And during this COVID-19 pandemic, I would say I have not been in country since the start. Until now, I am still nothing, but I've been reading and I keep up to Belize news. And I know that the people on the ground are doing the groundwork, because I know that they were getting statistics and all that. And from the statistics, it would show that to date, the indigenous groups have not been directly affected, but indirectly we are all affected, because we need to be careful, and our traditional lifestyle has to change, because we need to, everything is changing. What we need to focus now is, I think we need to focus on food security. Because most people now are locked in, they are not going to the farms, they are not doing what they are traditionally do. So that the support, whatever support could be given to indigenous people to maintain that and their craft. The markets are not open, so they cannot, even when the markets are open, things are limited. So they really cannot get the things that we need because of all this limitation in movements, and you have to be careful. So you can't mingle with your other indigenous, and that's one of the effects of the pandemic that I would relate to from what I've been reading, and I talk, and when you have discussions, you can, you know, that's what would, that is what would come up generally. The lifestyle has changed a lot. And so for that, I'm very grateful that our voices can be heard and we can hear from the others as to what, because we have been attending several sessions almost on the effects of COVID-19 on indigenous people. So this would not be one of the first sessions, but I'm hoping that this would be a meaningful session to see what, you know, what would come out of the session and just the discussions. Where we, right? So I won't be long, and I thank Birgit for having this session. For
I don't know if it is just me, but I kind of lost the president there for a minute.
Mick, I said thank you. So it was for the next person to, from his Coombs, to take over.
Jay, you are on mute.
Thank you very much. We lost some of what you said just for a minute on the limitation and movements, and I'd hope that you perhaps could clarify that, just so we have the full sentiment of your contribution just then.
Well, I said that there is a limitation on the movements because as the Indigenous group, we have Indigenous brothers and sisters on the other side of the borders, both borders, Guatemala and Belize. And because of all the pandemic, the issue with the pandemic, it limits our movement. So we kind of lose touch with our neighbors and our brothers and sisters on the other side.
Oh. Thank you. Thank you, Mrs. Miranda. So we have a list of your presentations or your discussions, and at this point in time, we'd like to call on Yahaira. I hope I'm pronouncing your name correctly, Yahaira Vega.
Yes, good afternoon, everybody. And yes, that's the proper pronunciation of my name. Okay. Well, I wrote down a few points that I wanted to share. And I wrote it down because I didn't want to forget anything, because I think it's very important that these points are brought to the table. And I actually did that for the 3 questions that were asked in the document that was sent on the email. I would like to start with the threats and the challenges that we're facing. And I would say that here in the north of Belize, I can speak for, because the Yucatec Maya presence is mostly seen in the northern region of Belize, which is the Corozal and the Orange Rock district. However, one of the major challenges that I believe we face as Indigenous people is that we don't have access to information on COVID-19 pandemic. What I mean by that is that Indigenous communities can only access the information if they have a radio, a television, or access to social media platforms. And if they do have access to that, then the information is basically presented in the English and Spanish language. I have seen that different Indigenous groups have taken it upon themselves to translate some of that information and even go as far as creating infographics so that this information can be understood and the channel of communication is clear between Indigenous people. However, there are several communities that don't have access to these type of technologies that still lack that information getting to them. And I don't know if this may be as a result of poor planning by government or as a result of the long-standing discrimination and disregard for Indigenous peoples. All of this contributes to further marginalization and greater risk for us Indigenous people, especially during this crisis. It is visible that we have seen that in the northern communities, we have also been affected by loss of source of income. And I think there are 2 main points when it comes to loss of source of income. Some, like many, have lost their jobs permanently. And we also have some that were tapping into the entrepreneurship or the micro-entrepreneurship sector and have seen a loss in their market with a drop in the economy. Then we have the point of the government assistance, which I believe is not reaching some of the vulnerable communities that I spoke about that don't have access to technologies and don't have access to know that these programs are even there for them to take advantage of. And that has a major impact on their livelihood situation because they have families to take care of, and their family sometimes includes many members. Also, the government assistance that I see is happening right now, which is phase 2, is only for registered companies or businesses, which brings me to point number 4, which is actually a question. Is there any recovery plan for those who do not own a registered company or are employed by a registered company? Because the way I see it, those people that work for like farmers or that do odd jobs, they're left without an unknown future ahead. And again, these are the people who have families, who have children that they need to sustain. Now question number 2, which says, what are we doing as a collective body to respond to these threats and challenges? And well, I can only speak for the stakeholders who are directly involved with our association, because there are still many communities that we have not tapped into and created a network of communication with. But each community that we have been in contact with is responding by what they know best, which is implementing mechanisms that are grounded in our traditional knowledge, customs, and beliefs. And some people call this indigenous or traditional knowledge, which includes that special relation you guys are talking about with our land use, our land practices, with the ultimate goal of ensuring our community survival. No, some of these communities have been helping one another with the little that can go around, and some are even risking themselves to continue earning a living, as is the case of the residents of the bordering communities who are even engaging in contraband activities as a form of income. And I've been seeing that a lot of people have been criticizing these people because, well, that is one of the sources, we believe, of the COVID-19 cases that are positive in the north. However, if we put ourselves in their shoes and that's our only means of income, that's the only way we believe we can make our money. And then we have the situation that many of these same people were in dire need of assistance even pre-COVID, you know. And I just think that there is not any means of sustainable employment in this region. Our largest employers would include the sugar industry and the commercial free zone. And with the closing of the free zone since March 25th, many who were employed have lost their jobs permanently. These people who again sustain entire families with that job. We have the case of the sugar industry, which will not start again until the first week in December, leaving 60% of those employed in the industry out of jobs for up to 5 months. Then there are those involved in the fast food sale, which I would consider would fall under the micro-entrepreneurship indigenous group. Like our tacos vendors, we know that the northern region of Belize is infamously known for our tacos and tacos vendors. And these vendors are basically holding on for the moment. But if we go through another lockdown in the district of Orange Rock, they will also join the number of unemployed. And it brings me to the same topic that we were discussing earlier, which include the artisans that are involved in the traditional handicraft making. These are also people who have joined the unemployed numbers, and there are some that if another lockdown occurs will add to that number as well.
Well, I see the latest is that the people on the island are getting really worried. They are desperate.
Yes, and then we have the last question, which talks about how Belize can draw on the traditional practices and knowledge of the indigenous people. Well, for me, this question, I believe I still did not answer it, but I do have some very important points that could be taken into consideration to find a generalized response for it. And it includes that, well, during the extended community lockdown we faced,
Yes, thank
traditional community practices came back into effect. And we saw where community members looked out, as I mentioned previously, for those in need and needed and extended the help to them. We saw that there was food sharing by those who had more to those who had less. In addition, we saw that the indigenous communities and in extension others learned about natural resources they can use for
you.
food and medicine. And
The
this
tour,
is this is a way how um,
but the tour
we
guides,
see all of those backyard gardens that people were posting on their social media platforms, and not only what we saw on social media, but from the different communication that we had with our stakeholders, many of them who had lost jobs, like our colleagues in the village of San Narciso. They are now resorting to planting. They have planted pumpkins, corns, okra, beans. They have planted um, um, to be able to reap, for them to be able to provide for their family, because there's no source of income coming. So they're resorting back to that traditional practice. Um, However, for some indigenous communities, the idea of quarantine was not really unfamiliar, because we had many of our brothers and sisters who are used to staying at home and cultivating the land and living in a sustainable manner. However, I believe that we also have to take into consideration that climate change too has impacted our agricultural cycle and our agricultural yield. The result will be that the communities will now have less food, like what Ms. Miranda spoke about. We need to now worry about food security. So we will have less food stock, and it makes us become even more vulnerable to hunger, especially if the quarantine lasts longer than anticipated. And and I can say that as well, some individuals that I have spoken to have 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 said this, because they are worrying about paying bills that the utility companies are expecting them to pay, and to a point are calling them and reminding them, you know what, you need to pay your water, you need to pay your electricity, or else you will be cut. I mean, some people are expressing that they will not even have money to feed their families because they want to be able to pay these bills and not be in debt. Lastly, I believe that this global crisis has proven and reinforced the need to respect and promote indigenous people rights, and that we must be at the table of development, as mentioned by Ms. Coombs, to be at the forefront of discussions pertaining to rights of indigenous people, indigenous land and resources, and our traditional practices to be respected and strengthened, because these things would mean a lot of things. It would mean less deforestation and destruction of nature, and it would mean that more resources would be available for sustainable livelihoods. It is our hope that the policymakers will include us and ensure that these rights are not forgotten during this crisis and after this crisis. So with that, I close off my discussion.
Thank you so much, Yahaira,
You're welcome.
for your contributions. Moving ahead, we go to Mr. Castillo, Andrew Castillo, first president, of National Garifuna Council.
Okay, this COVID-19 has been rough on the indigenous communities, as the previous speakers have said. The indigenous families have been affected like in a great. Like here in Hopkins, was traditionally a fishing and farming town. Now it is tourist oriented by virtue of the people who sit in these ivory towers and make all the decisions for us who are living in these various communities. In Hopkins, the men have experienced a severe loss of jobs, thereby unable to provide for their families. And because our lands have been either sold from us or taken away from us, there's little option now to go into farming. Now, some of the people who have been let go from the tourist industry have gone into or would want to go into fishing, but that can only happen if they have the requisite licenses. And so that is, it is prohibitive. Now, some of the folks here in Hopkins work away from home, and because of the inability to travel, that means they cannot either get to their jobs or go back home, because then they're risking exposing their families to this infection. As of right now, as we can see in the news, there have been some of those people who have been working in San Pedro, and they may now be exposing their families to COVID-19, or in some cases they have. Now, as a continuation of the marginalization that the indigenous have been experiencing, they are mostly relegated to unskilled positions, so they earn minimum wages. And they are often unable to move up the ranks because of discrimination. In my view, the government is of little or no use whatsoever, because they are either unwilling to do anything, inept, or their hands are tied for whatever reason. So this is a case where David, I'm talking about the marginalized, is going against Goliath, the business owners. In this case here in Hopkins, the owners of the resorts. And guess who is always coming out on top? And that's a rhetorical question. And there are ample evidence of people telling you what their experiences are in these situations. And I will also want to note that the minimum rate, the minimum wage here in Belize country is $1.75 US per hour. Just reflect on that, $1.75 US per hour, which translates to, I think, almost $3.50 Belize. It is actually a little less than that, right? Because I think it is like $3.30. So the big players, the resorts, are raking in the millions, and the locals, the marginalized, are raking in small money. Now in this situation also, the women who are part of the informal economy, because they provide different services like restaurant, massage, clothing that they sell, different crafts that can be sold to the tourists so they can earn for the household. But currently the household incomes have been decimated because there are no tourists whatsoever. So these people have been affected greatly. Children are also affected because they are single parent households where the children would be the ones who would go out and sell these products to supplement the household income. And this in turn has affected nutrition, as people are unable to buy the nutritious products that will serve the bodies of themselves and their kids. So they have to rely on items that will fill them. And these are often lacking in nutritional value. And we're talking about, right now, I will use the example of the noodles that they buy at the Chinese store. These products lack nutritional value. So that in effect will affect these people, not necessarily immediately, but in the long run. Now, these could have been mitigated by if the policymakers would have been cognizant of the realities of the local economies. Take tourism. Currently, the continued efforts are geared towards the presence of foreigners coming in. And this will not always be the case, and we can see that now. We have no tourists like that are coming in currently. And time again, the policymakers have noted slow season. Yet, they have never done anything substantial to mitigate this by encouraging what we refer to as staycation. That means having like the locals like travel within their country. And in fact, if any efforts have been made in that direction, it has always been minimal and in fact, at times dismissive. There are really a number of Belizeans who can afford to travel within the country, right? If they are made aware of what is available out there, rather than spending their money abroad, because we all know that there are tons of Belizeans who rather go abroad rather than staying home because they are not really aware of the richness that is existing within the country of Belize. The policymakers have neglected, and they could have been doing something in this regard to make it better, right? Currently, they can partner with major players to attract foreigners, but are last to engage with and for the locals. The protocols that are instituted are prohibitive to the locals, which eventually price out the locals from being able to enjoy their country. More effort and resources could have been injected into developing the local economies and businesses, but that has not been the case. Again, I repeat, more attention is given to the bigger players and not to the local businesses. Now, the lack of infrastructure and how expensive it is to engage in internet-based learning reduces the opportunities for kids to continue the learning process. In my mind, that the media could be involved in using the television to create virtual classrooms. One of the things we had done to mitigate the effect of this COVID-19 in terms of food was getting together amongst ourselves and created a food bank. And we solicited donations from not only locals, but also people from abroad who were born in Hopkins, and also people who have migrated to Hopkins. So that was some of the things that we used to mitigate this COVID-19. There's much more to be done, but that would be an extended conversation. So with that, I close out.
Thank you, Mr. Castillo. That was quite a contribution as well. Moving right along, we now call Juan Kukul. If you're ready to share with us your contribution.
Hi everyone, my name is Roberto. Sorry. Mr. Juan Kukul is right alongside me, and I'll be passing the computer over to him in a few. Just a moment. Mr. Kukul just stepped out of the room, and he should be back shortly in a few. So if we could just wait for him in the meantime.
Can I go ahead and do my presentation until he returns?
Yes, you may.
Okay. Hi, everyone.
That would be an apology on my part, Melissa. You were actually next. Excuse me for that. I went to Mr. Kukul before your name. Apologies for that.
Okay. Yes, so I just wanted to look at three main points in terms of how the pandemic is affecting the Indigenous community. we had tried to request statistics from the Ministry of Health as it relates to, you know, the number of cases and the number of indigenous people who may have contracted the virus. And the ministry currently does not record the information. They indicated that they have a field in the database for ethnicity, but it was left up to the healthcare practitioners to use their discretion and kind of put in an ethnicity if they so chose. So that is an issue because we still don't know if there are any indigenous persons affected, and based on the information that they provided, there were fields for mestizo, Latino, Spanish, Hispanic, which, you know, so that is one issue. And I'm hoping that since we brought it to their attention, that there might be, you know, some adjustments being made so that we can get a realistic picture of how it's affecting the various ethnic groups in Belize. Secondly, I wanted to touch on education. The schools have been closed for an extended period of time. There are some parents who, because they're unsure, you know, of what is happening when school is going to reopen, and you know, Belizeans tend to have a culture of waiting for last minute. There are some parents who still have not registered their children as yet. And so they're missing out on a lot of education or you know, teaching opportunities. There are some schools that are trying to do continuity plans to engage the children. There was a huge debate a debate in terms of homeschooling or parents looking to that as an option simply because they were afraid to send their children to school. I'm not hearing much about homeschooling now, so we're not sure as it relates to, you know, if parents are still considering that option at this time. Third factor, a lot of our Garifuna males they are artists, they're creators, they're musicians, and this pandemic has adversely affected them because, you know, usually around this time, the summer months, there are different festivals, different activities where they would be able to make money to take care of themselves and their families, and they have not been able to do that. They're trying to do virtual shows and online concerts, but it doesn't have the same impact. So those were the three main areas that I wanted to touch on in terms of the pandemic and its effects on the communities and our lives as Indigenous people. Thank you.
Thank you, Melissa Zuniga. I want to recognize you. I missed your name earlier, and somehow I ended up with the other participant. Thank you so much for your contribution and your insight. If Mr.
problem.
Ready, we can proceed with his contribution, please.
Good afternoon, ladies and gentlemen. My humble apology. I'm Mr. Juan Kukul, President of the Toledo Alcohol Association. Firstly, I would like to reference the COVID-19, how the indigenous being affected. Firstly, I could say that the Toledo in a whole is being affected, especially our indigenous people who produce their own crops and focus to sell their crops in the market. And now that whenever the restriction is put in place, state of emergency, our indigenous people had time to come to the market to sell what they are to sell. No? And on that occasion as well, it is very difficult that in Toledo, in a whole itself, as you know, there are no big companies that provide jobs here. We have some of our indigenous people who goes out to find jobs. When this COVID-19 come into effect, they all return back to home. And now that the income is not there as being expected, so that is where we're feeling the impact from this COVID-19. We are trying to respond to it as by advising the people to stay safe. Thanks for the good Lord that at this moment, none being found positive in Toledo. So we are a bit worried as well because we have some Maya communities who are nearby the border. So we try our best to educate our indigenous people to maintain the safety rules being directed by the Ministry of Health, advising them not to go across, and whosoever they see or saw coming in to the back, from the back, without the proper authorization of entering the country, we advise them that they should immediately report it to our office or to the Ministry of Health so that they can be looked after, tested, and put them into quarantine. And we are trying our best to encourage our indigenous people to keep planting their crops so that if you noted with this COVID-19 relief fund that was put in place, some of our indigenous people get and some not get. And during that, the first peak of the COVID-19, our organization tries its best to ally us, to try fundings, to try support our indigenous people who are in the far south. So this is where we are trying as the organization to assist our people, and this is what we are doing with our indigenous communities, advising them to be safe. That's it from me.
Thank you very much, Mr. Kus. No, Mr. Kuku, thank you very much for your contribution.
Thank you, welcome.
Pablo Miss, if you are available, we could now ask you to provide us with your insights, your contribution, and your expression of concerns and needs.
Mr. Pablo Miss is not around. He has an emergency to deal with in his village. Therefore, he asked me to sit and represent on his behalf. My name is Eludio Rash. I work with the JCS as well, Maya Leaders Alliance.
Okay, thank you, Mr. Rash.
Sure. To start off with how the pandemic affected our indigenous communities, it affected severely. One, there's lack of recognition from the state by itself. If we can look at it, when the SI 59 of 2020 was in effect, one of the criteria, there is no mill pub burning, sorry. Therefore, the association and the leaders in each community has immediately outraged or voiced their opinions that this is, they felt that it is a kind of discrimination. There's no recognition to the livelihoods of the indigenous people. Thankfully, that SI was revisited, and there were recommendations that was given, and there were requirements given to the community leaders for them to burn their milpa farms. If we would have looked at now, the milpa farms were burned and it was planted, and now they are in production. 3 months had gone already, and now we have crops that is producing. And the challenges that we continue to face, like others mentioned, with the technology. Most of these assistance were through online, like the food pantry, the unemployment reliefs. Our communities, remote communities, are not accessible to these technologies, to these signals of the telephones or internet. And we tried, the office tried its best to assist as many as it can so that they can apply. But again, what we realized is that some of these farms does not have, like for farmers, if we can look at the second phase of this relief, it does not have for farmers where they can also benefit. Everybody is impacted, even the farmers, the carpenters, the artists, all of these individuals has been affected tremendously. What are we doing with the Maya communities on our part is that we have been assisting them in several ways. What we did to the border communities is through our food relief assistance, we purchased over 40,000 pounds of grains, which is beans and corn. And we issued back to those communities that does not have these grains. Now that the pepitos, beans, and corn is also in production, what are we going to do for them? The borders are closed, and these border communities produce in bulks. And if we fail to produce or we fail to buy these products, they will be at a loss because these products will be damaged. But how can we draw from the traditional, what can we draw from the traditional knowledge is that, one, we know that the Maya communities are hardworking people and they will continue to sustain their livelihoods. Many communities now have ventured into farming, and we are now seeing that most families will have, can sustain themselves through this pandemic. However, the most challenging part is like the soap, salt, like sugars, some other produce or other items that are not produced by the communities. Even shops or grocery stores run out of these items, and it is very difficult for them to access these materials or these items. So that's from my presentation.
Thank you very much, Mr. Rush. Very insightful. Your contributions are well appreciated. Roberto Kus, if you can share with us your thoughts, your insights, your contributions as well.
Yeah, so I think my mic is working now. Afternoon, everyone. My name is Roberto Cos. I am the youth representative for the Maya Leaders Alliance on the BENIC. My presentation will primarily be focused on education and how youths are impacted primarily in the south, which is Toledo, and how sort of they've been trying to adapt and how the limitations that they face whenever trying to access virtual schooling or other methods of schooling that have been pushed by the government. So the threats, I mean, the effects of COVID-19 has been felt within Belize. Sorry.
We seem to have lost you, Roberto. Are you still there?
Yes, I am.
Okay. We lost you. The threats are being felt throughout Belize. So if you could start from there.
Yeah, as I was saying, the effects of the COVID-19 pandemic has been felt throughout Belize, but it has particularly been very felt very strongly within Toledo itself. Particularly youth who go to the school outside of their villages or outside of their community. For example, a lot of the students within Toledo go to maybe Belmopan or all the way to Punta Gorda for tertiary education, which is my case. The the effects of the pandemic has pushed us back to Toledo, where we have limits in reference to internet access, electrical access, and even telecommunications access. And so with the reopening of schools in a few, as a matter of fact, next week for the tertiary institutions, and then this has forced a lot of students to sort of have to wait until the schools offer face-to-face or in-person classes, as they do not have the technology to access virtual schooling, or whenever they if they were to access it, they would have to come into town, risking exposure should the pandemic spread or COVID spread sometime. And so one of the also that's particularly with the tertiary institutions, and then for secondary institutions, youths within or high schoolers, they go to a high school outside of their district. Outside of their communities, and then with that they then have to go back, and they also lack the necessary tools to access virtual schooling or access other additional materials that they might need for their own schooling. And then now I'd like to shift on how the Mile Leaders Alliance have been responding to the COVID lockdowns. As Mr. Rush said rightfully, the organization has been finding various ways to assist local Maya communities. For example, he stated that they've been trying to build the capacity of leaders to sort of report individuals that may not be abiding by the lockdown protocols, and also the grains program, or where they purchase surplus grains from farmers, and then they redistribute that to other families that may not have the grains that they require or assistance that they require. And then how do we draw from our traditional knowledge as we move forward? As Mr. Coco said rightfully, a lot of his advice is simply to plant more, and so that is right. A lot of individuals that work outside of Toledo have been coming back to Toledo, which is their home, and it is always going to be their home. And so a lot of individuals coming back have resorted to farming, farming within their own backyards, or farming within their milpas of their relatives or other people. And so this security that they have is very vital, that they can return back to their homeland and plan and be able to sustain themselves and their families. And that would be my addition to this forum.
Thank you so much, Roberto. Very insightful as well. Lots of specific ideas relating to young people, and how you've also been able to look at this experience and the impact of COVID on people's own household and individual response. At this point, colleagues, we've heard from all the representatives of the Indigenous organization, or the Indigenous people leaders today. I do want to now open the mics, if you like, and for you to take the opportunity to ask questions, provide some feedback, or generally expand on some of the concerns that you've heard from today. There are a myriad of these. And so feel free now to pose your questions or your contributions to the leaders who are with us this afternoon.
Specifically, Mr. Mick said the tertiary institutions will be open for classes. That I believe won't be happening, at least for the University of Belize. All of the classes are shifting to an online modality, which poses limitations to students, particularly within the South, where they have the lack of access to technology. So if that answered your question, Mr. Mick.
Yeah. Thank you so much, because I was a little concerned about that, because you don't want to be indulging in crowded classrooms. That would
Yes,
not
yes.
be the best thing currently.
Yeah.
Okay, good, thanks.
Okay.
And again, I go with the suggestion, like, I don't know what we can do to reach out to government, but let us, like, let the government communicate with the media and establish virtual classrooms. Because, of course, we have a number of people who don't have access to TV, right, But I believe, personally, I believe that the majority have access to it. So they and the Ministry of Education could get together and see how you can provide some lecturing, over the TV, because there are a number of programs. Personally, I don't watch TV, but when I do watch TV, go ahead.
Mr. Mick, I want to draw your attention specifically to Toledo when I'm talking about lack of access to technology. This doesn't mean internet. This also means electricity. So with electricity, no electricity to power these televisions, it would be still very difficult for them to actually access this information.
So one of the ways we can mitigate that is, like, it doesn't have to be every day of the week, but, like, certain days of the week, like, they can go to an open hall, like, you have Julian Cho, you have whatever the other high schools are. They have, like, some auditoriums that could be utilized. It will, personally, I think it will provide adequate social distancing.
Yes. One thing I would also like to mention is that while the traditional form of education, when I mean traditional, I mean Western form of education, has ceased, at least or paused for the moment, traditional forms of education has still been ongoing. For example, a lot of the families have been taking their children to the milpas, to farm, to still teach them the way of the land throughout this time. And that is very crucial to the passing on of knowledge from elders to youth as Indigenous people.
Okay, thank you very much. And I'd like to open the floor to the other participants as well. I've not necessarily listed the representatives from the UN in a specific order, so please feel free to pose your questions or add to the discussion so far.
Hi, Jay and colleagues. Can you hear me?
Yes.
Okay, I was raising my hand, but I guess it's not being monitored.
Don't have the feed. It didn't figure here. Sorry.
Yes,
Is
no
anyone
problem.
else using the raise your hand? Okay.
I don't believe so. But so I have a question, but first I would like to thank all the presenters, and I'll just turn on my video for this purpose, if you can see me. To thank all the presenters for all the insights that were shared with us. I mean, this is very key information that we can only, for the most part, learn from those who are actually experiencing this. And so I just want to reiterate the thanks that were expressed earlier for having the opportunity to have this conversation, but also after hearing, to say thanks again for what was shared. And I know that a lot, for me, some of the things that stood out was the risk communication, not reaching the communities and not in the format that is necessary, because this is an area that as a UN we are all working on. So it's something that is alarming for us in terms of the COVID-19 information. And of course the food security. But what I have not heard a lot of, and I would love if any one of you could provide some insights on the impact of the COVID-19 on women in your communities, in terms of perhaps the burden of care, or how livelihoods, how their livelihood is affected. I know Mr. Castillo shared earlier about He spoke a little bit about the women and their role in the informal sector and so on. But if I can hear a little bit more about how women specifically are being impacted in this situation, and the reason for asking, I should have opened with that I am Tisa Grant and I'm with the UNFPA, which is the United Nations Sexual and Reproductive Health Agency, and our work is a lot around gender equality, the sexual and reproductive health and rights of persons in general, but we also work on in terms of women's empowerment and so on. So we'll stop there so that somebody could perhaps share some insights.
Any response to Tisa from UNFPA's concern, query about women as well?
Well, I think during my discussion, I spoke about some micro entrepreneurs, and well, most of the micro entrepreneurs that I know of are female. Most of the tacos vendor stalls are owned by female entrepreneurs, and likewise with artisan handicraft. So these are the two industries that I believe that women, indigenous women would be affected. And at most of the time, we also have that statistics that show that these women are of a single parent household, you know. So I think that is something that we do need some factual statistics to show that information, because all we're basing ourselves on is the oral information that we do know. But I'm certain that if we go into the field to do the analysis of this, that those will be part of the outcome.
Thank you for that. Just to follow up, in terms of another area of work for us is in the area of gender-based violence, which we know is something that increases exponentially during an emergency or a humanitarian situation. And so I don't know if you have any insights in terms of that as well, because I know there is a mention of the livelihood and the economic impact. But is there any known impact in terms of the burden of care on women, in terms of their domestic responsibilities being increased as a result of this, or is there any? We know there is a lack of data indeed, but is there any anecdotal evidence that would suggest increases in gender-based violence maybe within the home, among persons, other areas of need that might be created as a result of COVID, perhaps even reduced access to other forms of health care that are not COVID specific.
And really, anyone could provide a response to the question that's just been, the questions that have been posed.
Let me just say this. There is historically in Belize, we live in a misogynistic society. So while there may be an increase in gender-based violence right now, unfortunately, we don't have the statistics to say that. But it is expected by human nature that if in a full household, in other words, two parents and then the kids and that kind of stuff, if there's a situation as we have right now, that these two people are in continued contact with one another, obviously some tension level will raise in certain areas, especially when the man has that frustration that, man, I can't avoid for my family, but I have to take this energy out on something or somebody, right? Except that we don't have those statistics. Because when the women go to, and this is a known fact, when the women go to the authorities, oftentimes, and the women can answer for this, oftentimes the complaint they're making is not really respected, because they're told, listen, that is the man, you need to listen to him. When in fact this person is experiencing a traumatic event. but the misogyny in the society continues that madness.
Thank you, Mr. Castillo, and Yahira also for your previous responses.
I have to add though that abuse comes in many forms, and it's not only violence, but there's verbal abuse, there's different forms of abuse that if we go into it, we can extend the discussion. But I believe that I, in a way, must disagree with Mr. Mick, because although the statistics that is available shows that men are the one who are more prone to become violent towards women and children, because we have to take into consideration that the children are part of the statistics as well. I believe that there is also lack of access to healthcare professionals that could assist women and children, and even men, because sometimes the women are the one who are abusing the men in some households. But I think that there's lack of access of information of where to go, where are these safe places, who can you talk to without coming out of your homes, because remember, we're now dealing with this during a crisis, during curfew, during quarantine. So what are the means of communicating these abuses that are happening to the relevant authorities? And we also have to take into consideration to make sure that the authorities that are put in place do not tell you what Mr. Mick said. Oh, well, we live in a machisto community and you'll just have to live with the abuse. No, we have to put people there who are trained to deal with those type of situations and to be able to deal with individuals from diverse backgrounds such as IPs.
Any other reactions or additional insights, questions on other matters raised previously by the presenters?
Okay. This is Noreen. I'm Noreen Jack, and I'm the Pan American Health Organization and World Health Organization representative in Belize. And I want to really thank everyone for your presentations. I've learned quite a lot. I have some questions as well. We, as you know, primarily focus on supporting the Ministry of Health and have worked in terms of increasing testing, health systems, preparedness, procurement of a number of items, including the items called PPEs, but as well as in communication. So one first question really relates to and it's the communication and the information, because we produce some PSAs in Mayan and in Garifuna. And, but I've just learned the limitation. The limitation, it was on the radio and it was sent through like WhatsApp, by telephone. So that's clearly from what you have just indicated to me, will be great limitations, so you may not receive them. So this is something I don't know how we can resolve, because they exist. This information already exists in many areas, and how we can share it with you to get it into your communities. I would be really happy to learn from you what process we could be we can have to move this forward. The second questions really relate to the health issues. And in terms of information from other countries in Latin America, largely more than in the Caribbean, we've seen that the indigenous communities have been many have been highly affected by COVID. If you look at information from Brazil, from Colombia, and so on, the indigenous communities are really affected. So my question is in terms of how can you prepare? How would you want to prepare? You're saying that you have no cases at this time, and I understand completely that because the surveillance system is not picking up biodiversity, it's not going to be identified. But in terms of your access to testing, your access for caring for someone at home, because some people can be cared for at home, but if it is not done in a particular way that will prevent infection being spread from one person to the next, then the whole household will be affected. And if again, and then it can spread to the community, and hence the reasons why some of what took place in some of these other countries among indigenous peoples. So that's one of the things. And then your access to the care for testing. So if someone is sick, where would they go? What are the other neighboring health centers or health posts? And I have learned somewhat about Toledo, but again, I would love to hear what are your issues in getting access to care to be identified. And again, if you need to go in, if you have more severe illness, what's the impact there? That means going into a hospital. It may be going into like KHMH here. What's your feel about that? Because that removes you completely from your community and maybe also from your family and so on. So I want to stop at this time, but this is like what I would really like to hear something from you and maybe how we can help further and especially related to the health issues. So over this time.
Thank you, Noreen. So we would like a response to the care access information and your provision of care within your communities, especially. And feel free, this is for everyone to have an opportunity to respond.
Well, here in Hopkins, we have a health center, which I think is relative to a polyclinic. I'm not certain, but someone have heard that designation before. So we have a health center. The problem that I had with it, and I think it is being corrected now, is that it was open only from Monday until Friday. But somebody sent me a flyer earlier, which I will need to post, saying that it will now be open on Saturdays also. So we have but right here in Hopkins, we don't have a resident doctor for Hopkins. We have, I think, a public health nurse and another nurse, a druggist, and the like, but no resident doctor. And the reason being, like, the doctor has no quarters here. But down the road, maybe like 5.5, 6 miles from here, on the road heading to Dangriga, there is a private clinic run by a doctor who has roots here in Hopkins, so she's familiar with the nuances of cultural tradition. Other than that, if there's any serious case, up the road, just about to the junction to the highway, there's an ambulance service. It is a private ambulance service that is available to transport people from point A to point B, be it to Belize City or to Belongpan or to Dangriga. I personally, well, we have the hospital in Dangriga that we have access to. But in a case like this, we have this pandemic that is taking place, unless there were some structural changes that were made the last time that I went there, the hospital is not adequate current. Again, that's just my personal view. Maybe others may have a different view, but I wouldn't, it is there, but I don't have too much confidence that they would be able to take in not even 5 patients with COVID-19 right now, in just my personal view. So that is my view of the health situation from here in Hopkins.
Any other feedback on access to information? That was highlighted at least 3 times, that the information is limited or perhaps is not in a language that you understand, and also require the use of internet and other technological services that may not be available in your respective communities. Can you offer some additional insights on how this information can be further shared in your communities outside of these technologically dependent media?
Can I interject?
Certainly can contribute, of course.
Thank you. One of the strategies that the Maya Leaders Alliance, the Toledo Alcaldes Association have been is sending the credits to our community leaders in case of emergencies, or some of them does use the other service, which is communities near the borders. They have Tigo service, and those needs more credits, so phone credits. So we assist them once with some phone credits. And our program director, Mr. Pablo.
Just a minute, I'm not sure if we heard the first solution or at least proposed idea. Did you say text?
Text messages.
And for the interest of everyone, Tigo is not a local internet or a telephone provider. Tigo is actually a Guatemalan telecommunications and internet service provider. But for communities in the South, they have stronger network connectivity to the Guatemalan service provider, in this case, Tigo.
Yes. So we were trying to inform them day by day on updates of the Ministry of Health. We keep sending messages. However, like we mentioned earlier, some of the challenges is that they don't have phone signals. So these community leaders knows that there may be text messages, so they go to the area or hilltops where they can get serve phone signals. That's where they can only make calls to the office to express their concerns. But one of the concerns, or some of the concerns that were coming out from the community leaders is, one, lack of response from the health services. If they report someone that is arriving from an infected area, then the response will be late. These community leaders does not have the resources to deal with individuals who are, are suspected persons that comes from these hotspots. So that is some of the challenges that we are seeing down south. But again, we have tried to assist community leaders with some face masks, so that in case of any emergencies arise, then they can use those. But again, it is not for everyone. If more cases arises, then we don't have that resources to provide.
Thank you very much.
In response to the woman, one of the questions asked earlier, how the women get affected as well. Looking at our indigenous communities, men and women are equally impacted by this virus. As you know, women also provide income to their family, having arts and crafts or artists work, small vendors, all kinds of cultural activities that they can do to sustain their family has now been, inactive, I should say. So men, children, and women are equally impacted in this crisis.
Thank you. Any other comments, questions?
I
feedback?
would like to add that a way of basically being able to distribute the information to all communities so that none is left vulnerable is to network with the different groups that are available, such as the district, what's it called? The District Association of Village Councils. Because here in the north, most of the villages, well, I think all of the villages have their respective village council representatives. And this is a way, or this is the organizational structure from which they get a lot of their information. So I think that if a network can be started with the different district association of village councils, I think that would help a lot for that information to get disseminated. We also could do roving of information through speakers and a vehicle. Therefore, there won't be that face-to-face contact with people to avoid any spread of the virus. But at the same time, people will still be hearing that information. Because although we have some communities that don't have access to telecommunication services or even radio access or electricity, these roving activities or these roving
Public
days,
address, the public address system.
can help can help to get that information out there. And I was going to suggest as well to get out some infographic posters, because especially if we're trying to deal with the barrier of language or communication, I guess infographics is a way to get that universal message out, and to just strategically place them in entrances of communities, or even use billboards that are available in the different communities to be able to get these message across.
Once again.
Good afternoon, everybody. If I may, I'm Michel Guinan. I'm UNICEF officer in charge. So first of all, I wanted also to thank you all for your very insightful presentations, and wanted to share also, as you know, UNICEF is working towards the fulfillment of children's rights and as well as women's rights. And our main areas of action include child protection and the protection of children against violence, education, health, nutrition, water, sanitation and hygiene, as well as social protection. And in relation to those points, just wanted to indicate some of the actions we have been supporting together with partners, both from civil society and government. So for instance, we have been supporting the Ministry of Education for distance learning through television, radio programs, including BENIC Together, but also the production of printed lessons from preschool up to secondary. So maybe also to confirm with you if that has been received in the communities and is sufficient or not, especially now that school opening has been again postponed. In relation also to the protection of children, one key aspect is also to ensure that the rights to education, health, and other services are granted from the beginning, from birth. And so in relation to birth registration, recently together with Vital Statistics and the UN High Commissioner for Refugees, we supported brigades to ensure birth registration, in south, north, and west part of the country, knowing that even if the country on average has a high percentage of birth registration, more than 90%. However, in Toledo, according to data from 2018, half of the children that were that had birth on that year were not registered. And so we have been supporting that. I would love to hear about any additional challenge on that as well. So those are only some of the elements I wanted to share. And in a nutshell, if you would try to summarize what are the most impacts that COVID-19 has had and continues to have to children, what would that be? Thank you very much. Jay, you're on mute.
Any contribution for the questions or in response to the questions about birth registration in this period, perhaps, or earlier, as well as looking at the direct impact of COVID on children? So far, we're seeing that it's nutrition and education that stands out. If I'm reading your message correctly, Nick, are there any other challenges that you would identify as having a direct impact on children? And are mothers and fathers struggling or experiencing any difficulties with registering their newborn children as well? I just want to say that Michelle also spoke about UNICEF's support to education materials and perhaps to the substitution or assistance for virtual education. If you have any insights on how this is working or if there are areas for improvement, we'd also like to hear from you. We've heard quite a bit about the limited access to internet and technological assistance in this regard, but if there is something particularly important for us to note at this point in time, and for UNICEF especially, please do share your thoughts in this area. How's the nutrition of children as well? That's an area that we'd like to hear from, and if that has any impact on in this current period, and are children also benefiting from the food supplies and grains that, for example, the MLA has provided to households in this period?
A couple of things from my end. When we operated the food pantry, the emphasis was always on women and children. So a family that has a number of children, they would be priority. And then, of course, on the extreme end are the elderly. But generally, women and children were the focus. In terms of education, like the use of, for the people who have access to internet, one of the things that is causing a problem is the cost of having internet. The cost is prohibitive. So for education to go on in that particular way, it will be difficult because to buy data in bulk is pretty expensive. And even the monthly subscription for this service, it is also cost prohibitive. Because again, as I mentioned earlier, the minimum wage here is $3.30. You know, I was being generous when I said it was $1.75 US an hour. It's $3.30. And if you have a family, let's say a minimum family of like maybe 4, $3.30 an hour just doesn't cut it. And anybody can do the math and see it. So those are the, and in terms of nutrition, again, because of the lack of resources, the nutritional value of the meals that these kids get is suspect. As a matter of fact, just while we were meeting here, I had 2 kids come to my house and ask me if I have a job for them. And I had to, because you look at these kids, they're hungry. So I had to give them a job, you know, so I gave them something to do. You know? And it doesn't matter to me whether they did a perfect job or not. Just knowing that, you know what, I'm probably contributing to these kids having a meal, that was satisfaction. And this is only 2 kids. We have a number of kids around the place. Again, their parents are not working. So that is my contribution to it.
Okay. Thank you. Any contribution as well or insights on birth registration challenges or limitations?
I think that this one we would need some time to answer because we would need to do the relevant groundwork and research.
Can I something?
Yes, please.
What can you say about people islands, Ocker, San Pedro, that don't really have any in order to survive tourism and fishing?
We're not hearing you very clearly.
You hear me now?
Yes, and also feel free to use the chat button below, just in case your internet service is a little bit shaky at some point. But please go ahead.
Yes, just wondering, what can you say to people that lives on the islands, Kikaka and Pedro, that have to to continue dealing with the situation, because actually it takes a toll on the mental health of a lot.
Very good. So that's a question about mental health and how it is that people can be supported in this regard. Colleagues?
Yes. Yes, like in this region, because we have not much access to like any source of sustenance than fishing or tourism.
Which are currently, which are areas that you cannot participate in as much given the conditions and the limitations in that area. Okay, so mental health support.
Okay, I would start. I would indicate this is a great concern to, and it's not only to the people that's on San Pedro. I want to really, this is an issue for all people, and during this time of the COVID pandemic, both also including healthcare workers, I would also want to add. So there are many people. So there's been some work being done with the ministry, and I can speak about the Ministry of Health in terms of looking and looking to strengthen, because there are some things that already exist. And so therefore is to use some of the existing systems related to community mental health, given the knowledge that there may be limitations in human resources, which is quite clear, but also to involve members of the community to also participate in what I refer to as psychological first aid, which means that it's really training to give people some skills to be able to discuss and talk with other peers and family about many issues. So it's really a concern, and as the pandemic continues, it will continue to be a problem. And you've brought to the discussion a particular situation in one space, but it's really much more pervasive than just what's happening in San Pedro or Kikoka at this time. It's a work in progress, and you may not be feeling it as yet, and that may be in part certain limitations, but it has begun, but it's recognized. I'm sure I'm not giving you good answers yet, because you want a solution that is maybe more immediate than that, but it's something, given our discussion today, I would follow up further with the Ministry of Health.
Thank you.
Thank you, Noreen. We are coming to a close for our very useful and insightful conversation this afternoon. We want to consider this a start, but a meaningful one, as was asked earlier. Thank you for your time and your openness and your willingness to share with us. Our colleagues, my UN colleagues, have taken note of your many concerns, of the issues that may not have been obvious just now, but you have made very clear, and have indeed brought to our attention some additional information for us to consider in our programming and also in the provision of spaces for you to contribute. We welcome this opportunity, and we're grateful that you were able to join us this afternoon. This is not the last. Like I've said earlier, we are hoping that there will be a time when we can come back and discuss this some more. You have our various websites, and our contact information can be easily shared with you for you to contact the UN and to share information as well based on the actions that you will have been working on in your particular communities to deal with this issue, or that you will want us to bring, that you would want attention brought forward to as well. So we are grateful, and we know that these are hard times, but we hope that this space for you to share with us offers you an opportunity to get some ideas from your other colleagues, as well as to present very clearly to the UN where your issues are, and this allows for the partnership to continue. Thank you so much, and we look forward to discussing with you again. Have a great weekend, stay safe, and know that we are all in this, and we're thinking of how to make our efforts even better. Thank you.
Thank you very much for your presence, and I also wish to express that we would like to meet you later on in the next weeks and months for also telling you what we are doing and what we are taking from this meeting. And some of our agencies have programs with indigenous communities, organizations, and entities. So we would also like to present it to you and what UN is doing to extend our assistance also to your entities, organizations, communities. Thank you so much, and that was, as Jay said, one of a series of meetings we want to have with you over the next time.
Thank you, everyone. Thank you, Birgit.
Thank you as well. Have a nice day, everybody.
Thank you.
Take care, everyone.
Bye.
Bye-bye.